There really are secrets to becoming mentally strong, and it might not be what you think. We often think grit. Oh, if I have grit. What is grit? Is that just the ability to push through? We often talk about mental toughness as equivalent to mental strength. Also sounds like I'm just pushing through. Resilience. Resilience, I think, is a beautiful word. I often use it. But what does that really mean? Do you have these things or you don't have these things? Can you learn these things? Can you learn to be mentally strong? The answer is yes. But I'm going to put a little twist on this. I am a psychiatric nurse practitioner, so I have authority to speak in this mental health, mental toughness, mental strength journey space. But my real authority comes from my story, because that's where the secrets are. As you listen to people telling their stories of mental strength, resiliency, mental toughness, listen to the story. The secrets are in the story. My personal story is I have personally struggled with depression before I even had a reason to be depressed. And then in 2005, I lost my first son in a drowning accident. 2016, after 10 years of medical trauma, I lost my son, Reggie. Then I lost my daughter, Maya, 5 years later. And most recently, my husband. This is more than grief. This is a story of resiliency. This is a story of mental strength. Whatever your story, whatever hardships and difficulties and pain is coming your way, or maybe just a change in the season of your life, and you don't know what mental strength is, I am here to be your guide, to show you the secrets of mental strength. If you want to know more about my personal offerings, click the link below, get involved in my community. But what are the secrets of mental strength? I was just recently interviewed on a podcast for trauma therapists. And this trauma therapist was like, yeah, but how did you do it? But how did you do it? The how is in the story. It is not a simple 1, 2, 3, although I am going to give you 3 words to remember forever that will get you through anything. But I'm also here to tell you that it's not simple. That it is a journey that we are on, and struggling and difficulties and pain are part of that journey. But we don't have to suffer. And that is true mental strength, when we can learn to not suffer in the midst of those things. So what is the secret? The words that come to me when I think about mental strength and my journey and how I did it, yes, I have grit. Yes, I have demonstrated resiliency and mental toughness. But how did I do that? I did that through authenticity. And that's a very vulnerable place to be. And you see this in my grief documentary titled Strength in Vulnerability. Like, there is strength in just the willingness to be vulnerable, the willingness to be authentic. So what is authentic? What it's not is pushing through and pretending like the pain is not killing you. I don't want it to kill you. I don't want you to get into a negative loop that you're saying your pain is killing you. But I do want you to be authentic and vulnerable in like talking about that, working through that, processing it, like making it a part of your journey that makes you stronger, not a part of your journey that feels like it's eating you up inside. You need a little bit of insight for that, right? So authenticity, vulnerability, insight. Insight is this ability to know yourself. And we often talk about, oh, we should love ourselves. We should make choices that love ourselves. And I always say it is impossible to love yourself if you don't know yourself. So know yourself, then like yourself, then you can love yourself, right? These are part of the journey words. And in personal development, personal growth, learning new things is definitely part of that journey. But I want you to think of it as personal expansion. Because for many, many years, 20 plus years, I read book after book after book, and it was like, I'm just trying to incorporate this new learning. But how about, yes, learning, taking in information, but using it to expand. So instead of using the words grit, resilience, mental toughness, when I describe mental strength, I use words like authenticity, vulnerability, insight, expansion. That is mental strength. And how do you do it? Well, I've got 3 words that will sound simple that you can incorporate now and for the rest of your life that will help you on your mental strength journey. These 3 words describe the Mentally Strong Method, which is more like an 8-hour course. But the 3 words are think, organize, and choose. We all think. Some of us would even self-proclaim being an overthinker. But are you thinking efficiently, right? Overthinking by definition sounds inefficient. So learning to think through your problems. I do it through a thought map, but it is super important to learn how to think and reframe things into positives, not inauthentically, but finding those positive, finding those gratefulness. So you want to be able to think through your problems. Some people go to a professional counselor, a coach, a high performance coach. And I often think many of these self-development books miss a step. So they, try to tell you how to think, and they tell you everything is a choice, everything is a choice, everything is a choice. And there's definitely truth to that down to the spiritual core. But when you are dealing with real life things like grief and trauma and other people triggering you and anxiety and behaviors and choices and then injustices that you're seeing in the world, and it's hard to just choose. And so I have a word in between there, and it's organize. So the 3 words that you are going to remember forever: think, organize, choose. And when I say organize, especially you self-proclaimed overthinkers, it might feel like chaos going on in your brain. That does not contribute to mental strength. That is exhausting, right? That constant thinking on both sides. And if you're an empath, then you have to think about the feelings and thinking about the feelings and thinking about the dialectic, and all of these things are going on in your mind, and you're thinking about how it impacts you and how it impacts this person and that person in the world. That is exhausting. But you say, but that's how my brain works. Those things are important to me. Well, good. Let's organize them. Because I think oftentimes we hear mental toughness, grit, resiliency of like just pushing through, maybe putting those things in little boxes and putting them away and not thinking about them. And so you're either doing one of the two. You're trying really hard to put those things away, or you are mentally exhausted with all of the emotional connection and all the thinking connection that you do. Either way, it is not authentic mental strength. So I told you a little bit about my story. And yes, I am standing here teaching about mental strength because I really did the hard work. And you can see that through my documentary of like really doing the hard work, like working through the trauma. We often talk about you need to process that. What the heck do we mean process it? Well, I can tell you, we mean think, organize, choose, right? We've got to think through those things, organize them, and make choices in line with what we want. And when we make a choice, like, be confident in it. Because if you're anything like me, you make a choice and then you kind of go back and forth and you think, oh, this is not going to work. Think, organize, choose. How do you organize? How do you organize these things? You have your own feelings. You're feeling intensely other people's feelings. You are seeing both sides of these stories and you're replaying the dialectic in your mind. Well, if you learn to think through your problems and learn to see what the trends and the cycles are in which you manifest, and then you organize those things. So grief is dealt with differently, and I have tons of videos on grief. Trauma must be processed and released from the body. And I talk about this a lot in my intensives. I have a grief intensive, a mentally strong intensive, private intensive, group intensives. But this is where you come and learn intensely how to think through your problems, organize them, and make choices in line with what you want. You have grief? I get it. You have trauma? I get it. Those things are impacting you. You are emotionally exhausted. I get it. You feel depressed. I get it. But we can learn to process those things out of our body. We can learn to organize our negative thinking. It's not just about thinking positive, but I'll tell you, the more you can think positive, the more you can release those traumas. And everybody's got trauma. Whether you have big trauma, little trauma, call it injury, everybody's got something negative that they need to process and release. Maybe you're continuing to make choices, and those choices are contributing to how you continue to feel. Those are your responsibilities. Maybe there's this huge injustice. You look at, world's lack of peace and from the global setting to in your day-to-day life, there are injustices everywhere. How can we have a positive impact on those things and not allow the things that we cannot control to drain us physically, emotionally, spiritually? You can be confident in saying, I am mentally strong. I'm going to go into some questions. The first question is, I've always considered myself mentally strong. I've overcome so much in my life. I have focused the last 20 years on raising my children, and now my only child, who is a young adult, is making bad choices, including using drugs. I am at a loss. What can I do? First, take a moment and take a deep breath. That is heavy. That is very heavy. That is grief and probably some trauma in there as well. But when I talk about grief of losing my children to death, people get it. But then what about losing your child to choices that you have no control over, and you feel helpless and hopeless that they will come around, make good choices, be on a positive life journey? So first, and this is the hardest thing as a parent, you must, just like they say in the airlines, you must put on your oxygen mask first before helping your child. We often go, and I see this in my professional practice as well, when the children are younger and the parents can force them to come to therapy. They're like, here, fix my child. Please, please, please fix my child. And we can try, right? I can try. But first, I want you to focus on yourself. I want you to focus on, what do you need? I want you could learn the Mentally Strong method, think through this problem, the way that this makes you feel. You might be anxious, you might be angry, you might be depressed, sad. I don't know what the core feeling is, but you identify that core feeling. And then we map it out and we see trends in your life, not just what's going on with your son. And then we organize those things. And so we'll take some time to grieve, because you're grieving the loss of who you wanted your son to be. right? And in the big spiritual context, maybe his journey is different. And so maybe there's some spiritual conflict that we need to identify and work through. Maybe there's some trauma that we need to let go of. Maybe there's some behaviors and choices of yours, because you can't control his behaviors and choices. But we can get to a healthier, stronger place as the parent to have influence over our children. There's this misconception that we have control over our children, even our young children. We don't have control. We have influence. And obviously, the older that they get, and the more hampered the relationship might be, the harder the influence. So again, if you could think about like getting yourself to a healthier place to be a better influence for your son. I know this is complex. And yes, there are things that can help your son as well, but the reality is he's got to want help. Next question. I teach resiliency and use your program. Can you explain more about separating trauma? That is great. In the Mentally Strong method, we have 10 plus categories, and each of those categories you do something different for. Because when I was going on my journey and reading lots of self-development books, I felt like everyone was saying, think positive, and positive things will happen. You get some books around releasing trauma, but a lot of people don't identify as having trauma. I didn't identify as having trauma until like 6 months after my third child died, right? So I think we need to change the verbiage of trauma. Trauma is not just physical and sexual abuse. It is anything that changes your perception of the world into a negative, right? And so let's call it injury, moral injury, ego injury, whatever it is a injury on yourself. And so trauma, although part of your story, it is most healthy if injury is processed out of the body, right? So even my little thing that I often say, like my uncle called me fat when I was like 12 years old. And my whole young adult life, I thought I was fat. I was never really fat, but I believe that was an ego injury, right? That needs to be released out of my body. That serves me no purpose. And so how do we move those things out of the body? We fill it with positive sometimes, but sometimes the pain is a lot deeper. Losing my child, Maya died in her sleep with no warning, no medical trauma history, never spent the night in the hospital. And that was this huge trauma for me. And so sometimes, like when you're trying to fill it with positive, it's like stuck there. You're not going to just replace the negative with the positive. So you have to do like physical things to release that. Movement is the key to processing trauma. Now, from a professional standpoint, you could go to like an EMDR practitioner, a brain spotting practitioner. You could go to energy work, sound bowl healing, Reiki, but also you could go for a run. Runners talk a lot about how running is their therapy, right? It's moving things out of the body. So trauma or injury needs to be clearly differentiated from the other categories, because the trauma may have caused you to think negative, but you actually have control of your negative thinking. Your trauma may have caused your anxiety, but that's your anxiety. You own it also. And so trauma is just very different in that this is something we are trying to get out of the body. How it has impacted us remains part of our story, but the physical changes, the negative neural pathways that it caused, we want to get rid of those. Last question. I'm a professional and a recent empty nester. I don't even know what it means to be mentally strong in this stage of my life. Guess what? You get to figure that out. How amazing is that? You get to take a moment in your life, and this is where I am too. I have a total of 7 children. I lost 3. My husband also passed away. All my other children are grown and gone. And so I'm home alone. I am this pure empty nester and figuring out who I am. We took this role of motherhood for the last 20, 25 years, however long. And, when we're a young adult, we have these goals. You want to do this profession. I have this specific career ladder. I want to be a good mother, good wife, whatever your story or your personal vision was in the last season of your life. Did you lose some of who you are? If so, let's go on that journey. But also just, you get for it to be whatever you want it to be. I am now in a place where I am able to put my full energy into my profession and my career. But I did it also authentically, working through some of those hardships and traumas, turning my pain into purpose. We can do this. Continue watching my video on purpose. You are mentally strong.